like Nina said, my name is Lexie Bartunek. I'm the Community Services Program Coordinator for the Agency on Aging and Disabilities. And so I'm going to give you guys an overview of our agency. You do not need to memorize everything I'm going to tell you because it's a lot. But I'm just going to kind of let you guys know what our agency does and why we're starting this referral program and why you would actually send people to us. So this can be dialogue. Stop me at any time if you guys have any questions. I'm sure you will. And like I said, you don't need to memorize this stuff because I'm going to go through stuff pretty quickly because it's stuff for us to know internally. So we'll just kind of. Okay. So a background on our partnership. We partnered a couple years ago with Longview Fire Department. We actually had them call us saying we've been going to a lot of places, a lot of homes where people are needing some additional assistance but not necessarily needing to be transported. So what resources are available? The captain who called from Cal's was actually personal friends with our supervisor at the time, and so they were able to set up this partnership. And so we are in the process of growing it throughout Clark County. We now have it we started with East County, which has changed with some of their internal changes, and we just last month started it with Clark County Fire and Rescue, and now I'm here with you guys. Whoa. So what the Area Agency on Aging is, there's 13 in the state of Washington, so and they cover every single county in the United States and most of Canada as well. So what an agency is we are communities that provide assistance to seniors, adults with disabilities, and family caregivers. Sometimes we're state agencies, sometimes we're contracted with state. We currently are contracted with DSHS to provide these services. And so our mission statement is to promote independence, choice, well-being, and dignity to our service area. That's what we do. You can, like I said, you can find any agency on aging in any county in the United States. You can do it by going to this website or by calling us. We don't all provide the same services, but oftentimes when we're out in the community talking about what we provide, somebody's like, well, I have a mom who lives in Arizona and she needs help. What can you do for me? And so we can get you connected with those agencies as well to provide that assistance. I started in information and assistance, which is where everything starts, and so I have personally contacted Oklahoma, California, Florida, getting resources for my family members, so we're able to do that for anybody in the community as well. This is a map of the agencies on aging in Washington State. So we cover, we have an office in Clark County just off of Hazeldale Avenue, and that office covers Clark County, and then we contract with Skamania County Senior Services in Stevenson and Klickitat County Senior Services, and they have offices in Goldendale and White Salmon. And then we have an office in Kelso, and they cover Cowlitz County and Wahkiakum County, and they have a satellite office in Path-Willamette that they are at 2 to 3 times a month. We actually have a staff person who's there as well, and they still can call into the Kelso office. So the programs and services that we offer, most of our services are non-Medicaid, so they're not based on financial eligibility, so anybody can access. Some programs do have eligibility, and we go over that with anybody who contacts us. So kind of a rundown of some of these, and I'll go through them more specifically. Information and assistance, our family caregiver support program, which I know has been talked about, transitional care services, aging network case management, that's just a general case management for seniors 16 over, our gatekeeper program, long-term care ombudsman, nutrition services, case management, transportation, which is heavily used in this area, MIPA, which is Medicare information, Medicare Improvement Portability Act, I think is what it is, our senior health and wellness programs, care coordination, and Medicaid in-home assistance. So community services, which is my department, is the non-Medicaid side. Information and assistance is the front door where everything starts. So everybody can contact information and assistance in any of our counties. That's where you're going to start to get anything. Our former supervisor called us human Rolodexes because that's really what we are. We have, so I'll go through more specifically. We have a information database that we use that is now actually moving towards a statewide database that has, we here in Clark County have a couple, probably about 1,500 resources that are in there that are just in this area that are electronic at the fingertips of our staff. that they just pop in what they're looking for and they're able to access those resources. We have a resource specialist who is currently working to update all of those perfectly. We're just in the process of transitioning to this new system. We use Google a lot. When we don't have the answer, we're going to look for it where it is. So what information and assistance does is basically information giving. You call and ask a simple question, we'll give you that resource. If any of you are familiar with 211, that is an information and referral line. And so the main difference between the two, they are both amazing services. But information and referral, when you call 211, you ask a question, you get an answer, you're done. When you call an information and assistance line, you ask a question, and 9 times out of 10, your response will be a question to determine what services you're actually looking for. My favorite example that I use is when I was covering the phones, I had a woman from Battleground actually who called me looking for a doctor who accepted Medicare. My response to her was, why are we needing a doctor that looks for Medicare? Because I could tell she was under 60, she was younger, so very likely it wasn't for her. It was just a trigger that I had in my brain. Turns out that this woman and her husband had just moved to Battleground from, I believe, Hillsborough, moved in her mother-in-law, father-in-law, two developmentally disabled brothers-in-law, and their son was living with them because he was currently unemployed. Her husband was the only one who was working, and she was taking care of 4 people. Obviously, she needed more than just a doctor, so I had a conversation with her, was able to refer her to our family caregiver support program, and she was able to access some respite services to have assistance in providing care to her loved ones that she's still accessing to this day, and this was about 5 years ago. And so that's why we asked that question back at you, not to be annoying, but to actually gear you towards the correct services. I don't think I even gave her the name of the doctor within that phone call because we found a more pressing matter. So that is why they asked those questions. Service referrals, we did refer her for those programs. Advocacy, we're able to do some advocacy over the phone when we have people who contact and aren't able to make another phone call. Our program is one of the best kept secrets in the community, and we don't want to be, which is why we're out here starting these referral programs and talking to you guys, because more often than not, our specialists on the phone are the 4th or 5th phone call, and people are so stressed out that they can't make another phone call even though it's the right one. We're able to give them the correct one. And so in those moments, we're able to turn around and make that referral for somebody, make an extra phone call for them, and give them that extra step. We also screen for other programs like that family caregiver support program. We do all of the screening for all of our internal programs, which I'll explain a bit more. And then they're trained to ask those questions. Our specialists do go through a training process through the Alliance of Information and Referral Systems. And so they are trained to actually screen and gather information and resources for clients. Our family caregiver support program that I mentioned. So this program is support and resources for unpaid family members and unpaid family caregivers. And so that is not for those who are getting paid like through home care agencies, it's for unpaid because we have so many in our community. Washington State is very unique in this program. We implemented a new program about 5 years ago called T-Care. It's a tailored assessment program where our case managers actually go out and do an assessment on the caregiver, not the person receiving the care, the person providing care, because they're the one that we're going to take care of so that they can continue in their role. And so the services that we offer through that, we have a case manager who comes out to you. You do not have to come into our office, even if you live in Yakult, our case managers will come out here. We actually have a few people in North County. And so case manager will come out and do that assessment. Based on that assessment, we'll determine what resources they can access. So we have simple referrals to support groups in the community, education programs. We have several education classes that we offer throughout the year. We have conferences that we put on at least one a year. In the fall, we always have our annual conference. We partner with Peace Health, so that's always at the Peace Health in their Health Education Center. We're here in Clark County and Cowlitz County, it moves around where we hold that one. We have counseling services. We're able to offer sessions with counselors. We're able to offer respite, which is the biggest one that people look for, is a caregiver to come in and give you a break. The only rule with respite is you can't use it to go to work. You have to use it to give yourself a break. So you can go take a nap, you can go get your hair done, you can do whatever you want with that time. I'll give you all those numbers. And then we also can provide supplemental services, so we can help pay for emergency alert buttons. We've had some clients who have just needed incontinence supplies for their spouse, so we're able to pay for those sometimes, depending on the assessment process. Another piece to this is we do have a Kinship Caregivers program, which is for relatives raising children. And so we contract that program out through Children's Home Society here in Clark County. And that's in instances where if there's been a death or an incarceration or abandonment of a parent, often children get just dumped on grandma and grandpa's doorstep in the middle of the night with no clothes or anything. We have programs that can help provide some funding to purchase clothing, purchase bedding, purchase groceries, and help get services for them. And so that's a program that we also offer. And all of these programs are offered in all of our service area, because I know you guys have some in Skamania and Calais as well. Our case management, so we do have Medicaid case management, which I'll mention at the end, but when we're on the phone with somebody and there's services that they need beyond what we can provide over the phone, we can refer to our case managers who can come out to them. People are welcome to come in the office as well, but our case managers do go out to everybody most of the time to kind of sit down with them and see what other resources they may be able to access. And so it's just more in depth than what we can do over the phone. So give them those referrals, do assessments to see if they would be eligible for other services, crisis intervention. Sometimes we're able to work closely with Adult Protective Services if necessary, if it's kind of a situation that's not necessarily worthy of protective services, but they do still need that assistance. We can work with them on that. Senior personal care, this is a program to actually provide that personal care assistance for those who do not qualify for the Medicaid program. So there are some financial eligibility. So if someone is needing, bathing assistance, transferring assistance in the home, and they are not eligible for state benefits and can't privately afford a caregiver, we have this program that can provide some minimal assistance to them. And again, our information and assistance does this screening process, asks them the financial eligibility, and refers them for an assessment. Transitional Care Services, this is a newer program. This program came out of the Affordable Care Act and healthcare reform due to hospital readmission rates being so high. And so what we have, and we currently do have partnerships with Peace Health and slowly growing with Legacy as well, where we have a transitional care coordinator or a care coach who actually goes out to the hospital and works with patients who are in the process of being discharged or will soon be discharged, and works with them. It's kind of a 30-day intervention, works with them to prevent them being rehospitalized. And so our coach usually goes and visits at least once in the hospital, if not within 1 to 2 days of discharge at the home, and sets up a medication review. It goes to doctor's appointments with them if necessary. Everything that they need to prevent them from ending up back in the hospital due to their chronic care needs. And so we had one situation where our coordinator went out to the hospital to visit a gentleman who had, I believe he had cancer, I think is what it was, and had a fall which put him in the hospital. He was homeless, didn't have a housing to go to when he discharged. She was actually, within that 30 days, able to get him on track to get housing. I think he got it on like the 60th day, but she was able to get him housing. She was able to get him medications that were not covered by insurance. He was on Medicaid, but he needed baby aspirin and vitamin B12. Those aren't covered by his insurance, and so she was able to get those through other community resources. And this gentleman was also set up to get, this is around the holidays, was set up to get gifts for his son, because he wanted to spend the holidays with his son as well. So she was able to connect him to those resources. So it's one that she works our coach works very closely with our other staff to coordinate all of those services. And so this is a very quickly growing program. Our care coordinator is currently on medical leave, but we're growing the program back up even in her absence. Options counseling is a program that we have not quite started, but is coming. It's kind of in between our information and assistance and our case management. And it's usually kind of a 90-day mini case management is kind of how I refer it, where if people don't really need that long-term support, but need somebody who can help them figure out what's available for them. It's really counseling them on what options are available in the community. And so that's something that we will be starting this summer. Kind of already do it in a way that they go straight to the case manager. It's just a kind of a lighter version of that. So that will probably be starting by the end of this fall. But people will still get the services they need throughout that. Just another name on the programs we have. Senior health and wellness, these are our wellness programs that we offer in the community. The biggest two that we have is our fitness classes. We currently operate Enhanced Fitness in Battleground. It's at the Battleground Community Center, 2 classes, 3 days a week. And we also have a class in Vancouver at the Trinity Lutheran Church, which is 1 class, 3 days a week. That class started last year. The Battleground class started 4 years ago now. We started it offering, we'll take donations for now. We'll have to charge for it eventually. We haven't had to charge for it yet because it's run purely on donations by the participants who come. Within the first 2 months, we had to add the second class because it is a very popular active class. I've participated in the class myself. It's a really fun class. Our instructor works very closely with each participant to work with what they need for fitness. So whether they use a chair, whether they use some weights, however it works for them, she really tailors it. And that is the same instructor for Vancouver as well. Like I said, it's free class, purely donation based. Other programs, we have education. So we have our chronic disease classes, which is living well with chronic conditions. That program is a free 6-week class for anyone living with a chronic condition or their care partner. And they're self-identified chronic conditions. You do not have to have a doctor's diagnosis to take these classes. We offer anywhere from 3 to 6 a year in Clark County, and usually 2 to 3 in Cowlitz County. And we try to offer them in Stevenson and Goldendale, but haven't had a huge turnout of people wanting to take it. So we do offer it at least once a year. And that class is taught by lay leaders in the community who are trained. Who more often than not, they themselves have chronic conditions, so they're really able to work with the people in that class. It's ways to manage pain, manage nutrition, manage your chronic conditions, and they love it. Also have Brain Fitness. It's a computer program that we currently have at the Cascade Park Library in Vancouver, where people can just come in and play some computer games and maintain their brain, keep their brain fit. It's been a very fun program that people have loved taking. You just go to the information desk and say you want to do it. And so we have had that there for a while and haven't grown it to the other places yet because people love it at Cascade Park. So that's one that anybody can come in and do that. And then oral health services, we partner primarily with the New Day Dental Clinic in Vancouver and a Cowlitz clinic that I can't remember the name of right now, to provide dental services to seniors. We have a grant that can provide seniors can kind of get priority on the list for dental services and get some dental care through those clinics. They manage the programs internally. So when people call New Day for any services, they kind of get screened in that if they're eligible for this program, they'll usually get services a bit faster.
Is there a charge for the oral health services?
No, there's no charge for the clients. We have funding to the dental clinics. New Day Dental Clinic is a sliding scale fee clinic, so there is a cap on how much that they can get through our program. I think it's like $500, so that won't always cover the whole cost of what they need, like for dentures. So there may be a portion that they would need to pay for if it goes over what's allowed. And that for those programs, they just contact the dental clinic directly to see what resources are available. They can also call information assistants who will screen them to see what other services they may be eligible for, because the free clinic does a lot of dental services, and for any age at their mobile dental clinics, things like that. So those are ones that best to call us first, and then we'll kind of screen for which ones to try and who's taking patients right now. Because sometimes there may be, a week wait, sometimes there may be a 4-month wait, just because of dental services are very high demand in the area. Gatekeeper program. This program is kind of just another name to access us. It's very similar to what we're doing with you guys. We have gone out into the community and trained just community members, gone to the Clark Public Utilities, we've gone to volunteer programs, and it's just a kind of a way to keep your eyes and ears open if you see things in the community to refer people into our agency. And so your gatekeepers is really what it is. And so it's just another name for the outreach that we do for you guys to refer people in. Our senior nutrition program, we contract with Loaves and Fishes, Meals on Wheels people here in Clark County and Lower Columbia Action Program up in Cowlitz County to provide congregate meal sites. We have 8 in Clark County. I think it's an Amboy up here at the it's at the Grange, I think is where it is now. It just moved. And so people can come get a hot meal, seniors 60 and over, and they're $3 or $4 now to do that, or whatever they're able to give. It's a suggested donation. They also do the meals on, the home delivered meals. So if people are not able to get to the meal sites, they can get meals delivered to their home. This is throughout all of Clark County for loaves and fishes. For Cowlitz County and Skamania, those are run through, like I said, the Lower Columbia and Skamania County Senior Services. We also have farmers market vouchers, which is a big program that we have in our agency. People go crazy for this program, and you guys can be the first community members to know that that is actually starting this week. For Clark County, the farmers market vouchers, well, for everywhere, it is $40 in coupons that seniors, low-income seniors can get to use at the local farmers markets and farm stores. And it's free for them. There is eligibility. There is a process they do have to go through. Here in Clark County, again, we contract it through the Meals on Wheels people, and they operate with a lottery system. So how it works for them is people either go online or to one of the meal sites and register for the lottery. The lottery opens up tomorrow. It opens up tomorrow, the 1st of May, and runs through the 22nd. So if anybody asks you about the vouchers, you can have them call our office or send them straight to the Loaves and Fishes sites. Meals on Wheels people, sorry, they changed their name and I keep calling them their old one. So these vouchers, people sign up for the lottery system. It's up until the 22nd. Then names are drawn the first week of June, and those who win a voucher will receive a postcard in the mail telling them where to go to pick them up. They have 4 sites in the community that they do that. And then once they get those vouchers, they can take those vouchers straight to the farmers markets or the farm stores and use them for fresh produce and honey. It's one of my favorite programs, but it's a very quick program, and so people, you hear about it, you get it, or it's too late. It's a once a year program.
So this is separate from the state SNAP or EBT?
Yes, it is. This is separate. This is a program through the federal government. It's through the USDA does it. We don't know we're going to have it until about a couple months before we get it. So it's operated through the state. Yeah, it's separate community, but you can use food stamps at the farmers markets now as well. That's a new program they've done. There is a program. This program is the Senior Farmers Market Nutrition Program. There is also a program for those who are accessing WIC benefits. And so when you go to the farmers markets or the farm stores, you'll see the signs that say WIC and farm senior farmers market vouchers accepted. For WIC, they have to go straight through their WIC worker. We do not operate that program. We only do the senior program. And so we get those calls a lot. So if people hear about it, because really we don't heavily advertise this program because it's so limited. It's word of mouth. I think last year we had about 200 people who didn't get vouchers out of that lottery system in Clark County because we ran out. And so the lottery system is the best way we've done it here. Cowlitz County does a first come first served basis where they distribute them at the farmers markets. And right now their distribution, I believe, is scheduled for the first week of June. And I can get that information out to anybody who has Cowlitz County people. Or they can contact Lower Columbia Action Program. They're the ones who maintain it there. And Skamania County, they operate it through Skamania County Senior Services, and those are being distributed first come first served basis at their offices in Stevenson on June 3rd and June 5th, I believe, and I can confirm those ones for you. Senior transportation, another program that could be accessed pretty well up here. So the senior transportation program that we have, it's a very, very small program. It is for people who are ineligible for any other forms of transportation. So not eligible for medical transportation, not eligible for CVAN, which is automatically going to be 99% of your population because they're out of the service area, and not able to drive or afford to drive. Even if it's short term, if they have a broken leg and can't drive right now, they can access this program. It is for 60 and over, and it's primarily for medical appointments, but it's not always limited to medical. It's up to our vendor that we use if they have the time and funds to transport to grocery store, community meetings, church, they can do that as well, but they do reserve it for medical. For this program, what people need to do is contact our office, and they contact information and assistants who will do a screening and ask all of these questions. As soon as they know their address, they're already going to know the answer to the CVAN question, because we do require people to go through the CVAN process, but we're not going to make somebody apply when we know they're out of the service area. So the majority of the people who do access this program are in North County and East County because they can't use CVAN. So that is one that you can definitely refer people to for transportation options. We currently contract with Safety One Medical Transportation, and they do cover all of Clark County. Transportation is within Clark County only, so they cannot take people to medical appointments outside of Clark County. So if they have an appointment in Portland, unfortunately, they cannot take them to that. And this, like I said, is only for Clark County. So Medicare Improvement for Patients and Providers Act, we actually have a person in the office who's our MIPA expert. So for people who are eligible for Medicare, can't afford their medical premiums, can't afford their prescriptions, she can work with them to help apply for programs to help pay for that. And so she is also a SHIVA advisor, which is the statewide health insurance benefits advisors. So she is truly an expert on Medicare and health insurance resources. So she's able to enroll people in these programs. So if people are having issues with health insurance, they can really just call our office and our specialist can help them. And she covers all of our service areas. So she does work with CALEX and Skamania people as well. Our long-term care ombudsman, this program are advocates for people living in long-term care facilities. And so we have 3 staff members and then about 40 volunteers who are assigned to every long-term care facility in the area. So they do cover all 5 of our counties, and they go and meet with residents. If there's any complaints, any issues at the long-term care facilities, they will help mediate conversations with the staff. They will help facilitate complaints if a complaint actually needs to be filed with the state or with the licensure. And so they're the advocates for the residents. So if you ever have anybody who's in a long-term care facility or has a family member and has any concerns, needs to speak with somebody, they can just contact the ombudsman and either speak with them over the phone, or they can set up times for the ombudsman volunteers to come out to them. I've actually used this personally. My grandmother is at a long-term care facility that is great, and we don't have problems with the facility, but my grandmother is not a happy person, and so complains a lot. She barricaded her door shut to them one time. And so the ombudsman has gone out and kind of helped facilitate the conversations, because it was really just a simple conversation that needed to be had of what her desires were and what their obligations were. And they matched it up and was able to resolve some conflict. The biggest complaint they get is food, which they will always listen to and will always make suggestions when necessary. Even though those aren't necessarily license or complaints, it's still a legitimate complaint if somebody's unhappy with the food they're getting. So these are for nursing skilled nursing facilities, assisted living, and adult family homes. So anytime there's issues with those, they can definitely call ombudsman. Legal services. With legal services, we do contract that out as well to Northwest Justice Project, to their CLEAR program. I don't know if any of you are familiar with that. It is a statewide legal referral program. So they do, when they call, they're calling to Seattle to get legal advice over the phone and sometimes refer to an attorney. It's a great program. It is very full, so sometimes it does take time to get in with them, but they are able to help with pretty much all civil matters. Biggest things they do is housing. Sometimes they can help out with kind of after there's been a death in the family, and to kind of the legal issues with probate, those kind of things. They have 2 programs. One is for anybody who's low income, and one is for anybody who's over 60. So there's not income guidelines for 60 and over. So that's all our non-Medicaid stuff. We do have Medicaid services, and so Medicaid case management, people who are receiving in-home services through the state, their case managers are with our office. If they are receiving financial assistance to live in assisted living or adult family homes, their case managers are with the state with an agency called Home and Community Services, and so they are receiving that case management to kind of follow their case, make sure they're getting the care that they need, setting up their caregivers. We also have care coordination. This program is a newer program that was, again, instituted with Affordable Care Act changes. Care coordinators are kind of overseers, people who are basically people who access a lot of services are eligible for this program. They access Medicaid, Medicare, they're on multiple services. They can have a care coordinator who coordinates everybody else. So if they have a case manager with mental health services, if they have a case manager with the state, if they have a counselor through employment services, the care coordinator can actually talk to all of those people, make sure they know what's going on with the other one, so that the individual is getting the most appropriate level of care. They are also able to go to medical appointments, so that everybody's aware of medical situations, like the transitional care. If usually people go into the hospital with one set of medications and leave with another set, so reconciling those to make sure that everybody knows what's going on and that medications have changed. That's really the biggest one that they do. They also provide them referrals to other services in the community. And this program has significantly grown. We started with 1 care coordinator in the fall of 2013, and we now have about 25, because we have so many referrals in the area of people who are wanting to access the services, because it's really getting them a higher level of care when everybody knows what's going on.
Is this the same as the transitional care coordinator? Is
No,
that the same thing?
it is not the same program. There is some overlap. They internally have transitional care services, but this one is separate. This program is specific to people who are accessing Medicaid, so state services. Basically, there's what they call a PRISM score, and so it's a formula that is used with the state of if they're accessing a high level of care, the highest cost patients, basically, whoever is costing the state the most because of the care they're accessing, are able to access this program. Transitional care services is not based on Medicaid. Anybody can access that program who's over 18. And care coordination is all ages. There's actually children who are on this program as well who are accessing high levels of services through the state. So if there's children with chronic illnesses, things like that, they can access care coordination. It's one of the only programs in our agency that covers under 18. What does all this mean? It's a lot to kind of throw at you. And so how do you collect them? So that's why we've started this referral program. We have this form that we've created, pretty simple form that and it can be used a couple different ways. The original intent was for this form to kind of be taken out when you go on calls, and so if you're at a home where, you've been going to this home, 10 times a month because Mr. Smith keeps falling and his wife can't pick him up, obviously needs some help, but don't necessarily need to go to the hospital. That was how it kind of started with those situations, is you guys can fill out this form and send it straight into us, and our agency contact them to offer some resources and assistance. So a lot of the calls that I had when I was in information and assistance was a similar call like that. We were able to get her on our family caregiver support program. She had a caregiver that she could call who was helping her with the home, and it didn't need to go to protective services or other things, and her husband was still able to stay in the home. So it's instances like that. So it's a simple form that you can take out and fill out. One thing that we did change, and there are copies, I don't know how easy this is to read from you guys, what we've added at the bottom is a release of information. This is one of the requests that we got when we started doing this with Clark County, is they wanted to know what happened so that they could track. So you can always refer people, no matter what. You can call us, you can email us, you can fax us, you can send this form in. But if you're wanting to know what happened, this form has a consent piece that if the client who you see signs this, we can talk to you after we talk to them. We can have a dialogue back and forth. So we've added that consent to it.
And I think at this agency, we're going to make it so that we can't actually refer the client unless they release that.
Okay.
So
Yeah,
that we
and
can do that.
that's completely an internal choice how you guys want to use that. And so that's why we created this form, so that we could have that option for people. And so it's very simple to fill out. You just fill out who's referring them, the basic information, and then you can send it right into us. The form does have our email address on the bottom. It just got cut off on this screen. Clark County asked if they could just take a picture on their cell phone and email it to us. That is fine if you can't scan it right into us. I mean, however you want to get it to us is up to you, as long as it meets your internal rules. And so this form comes right into our information and assistance office. The specialist will take it, will contact the resident and see what they can offer. Just say, hey, we got a referral form from EMS. You're needing some additional help. What's going on? What can we do? The more you give us, the more we can kind of start that conversation. But if we get their name, we'll just call them and say, what's going on? What can we do? And so that's where this came from, and that's what we want to see from you guys. At this point, the form is just for Clark County. I know there's a couple of you from Cowlitz and Skamania. You send them into Clark, our specialist will just refer them straight over to the other counties right now. We'll kind of figure out that process a little bit more structured, but for now, if it comes in, we'll send it right up to them. When we first started the program, we accidentally used an old form, and so our Kelso office got the referrals for Clark. So we share them. They talk every day. So the ways to contact us. So if you don't have a form, if you just have a question, you can always contact us. I know you're going to set up the policy to always, when you refer somebody, use the form, but if you're on a call or you come back from a call and you have a nagging feeling of, is there something I could have done? Is there some resources out there? If you in your personal life have a question, you can always contact us. I have our brochures, which have list some of the services we offer, as well as all of the phone numbers for all 5 of our county offices. have the business cards for our Clark County office, that have our phone number, email. You can fax, but that's really kind of, I wouldn't fax them to us just because we have one fax machine for the whole agency, so it will just delay getting the service. Emailing and calling is the best. The toll-free number goes to our front desk, so you just need to ask to speak with information and assistance if you call that toll-free number, and they will get you those services. So if there's a test, who do you call when you need services? That's your test. And so that number does go straight to our specialist. One thing to know is you get a human being. It's not an automated system. You're actually going to get the person. Unless they're out of the office, then you'll get an actual voicemail. Our specialists right now are amazing at returning phone calls. They usually have no more than about 5 messages in their queue, and they return them by the end of the day. So you do get a response within 24 hours. Same with the emails. They're doing this very quickly. Our Kelso office, same way, and our Stevenson office is very quick as well. So you will get a call back. If it's not within 24 hours, it means there's a reason why it's not within 24 hours, and it'll probably be within 2 days. So we will get those back. I do have the contact for our Kelso office as well, if anybody wants that one. And that's just really the best thing. So any questions from anybody on services or programs or what to do?
I have a couple.
Okay.
How long does it take to receive resources from your service?
It depends on the resource to have the conversation. You know, some are immediate when you call us. If it's
So like
something
groceries?
Groceries, it depends on the services there. We don't provide grocery assistance internally. What we would do is, depending on where the person was and what they could access, we'd refer to like volunteer organizations, or if they were eligible to get a caregiver, sometimes caregiving services can do that. For Medicaid long-term care services, that does take about 6 to 8 weeks to get set up, because the state has to come out and do that assessment. Those caregivers can do the shopping, so that kind of program does take time. Volunteers, it really depends on if and when a volunteer is available. Transportation, the transportation screening that we do is it's 24 hours really. If they call us before noon, we send it over that same day. If they call us afternoon, they'll get it by the next day. Because we do the intake and then send the referral, the screening form over to the transportation provider. As soon as they get that, the client can call them to schedule rides. They schedule rides directly through the company.
So we call you,
Mm-hmm.
or they call you,
Mm-hmm.
and you handle that.
Mm-hmm.
You don't give them a number to call back. You're not just taking their request and say, okay, this is a service you can use, this is a service you can use, this is a service you can use.
Sometimes.
Every day.
Sometimes.
Okay.
It depends on what they're looking for. If it's an internal program, we do the screening, we refer it on. If it's external, we give them the phone number. So for volunteer services, we're going to give them the phone number for volunteer chore. If it's a situation where, we're like the 5th phone call, they're having a really bad day, we can sometimes make that call for them, but we generally give them the phone number, we give them a contact. What we also do is tell them what questions to ask for. We ran into a situation several years ago where we were referring people to access Medicaid long-term care services, because we do not do the intake. That is done directly through the state office. So when people were calling for services, we gave them the phone number, we referred them straight over there. They were calling saying, I want housekeeping assistance. So the state, in turn, turned around and referred them straight back to us. So the calls were going in a circle because they were telling us one thing, telling the state another. So what we started doing, once we figured that out, was when you call them, tell them you're wanting in-home assistance. Because the housekeeping is not something that's covered. But in-home help, personal care assistance is covered, and you can also get some housekeeping with that. You don't qualify based on the housekeeping. And so when we did that, we tell them the right questions to ask. But yes, very often they will get another phone number. It's just going to be the right phone number and the right questions to ask.
Are these services available in all 50 states, 51?
Yes. Information and assistance is available in every county in the United States. What services are behind that differs based on state funding and program areas. Like our family caregiver support program, very unique in Washington State because of how we implemented it. For example, Oregon doesn't operate it the same way we do. For like respite care, we're able to offer like an average of 20 hours a month for respite care to give somebody a break. One point, Oregon is able to offer about 20 hours a year because of just how funding sources work and programs work. So they exist in some form. How it is just different state to state.
Do you receive your funding to the state?
We have state dollars, federal dollars. We have some grant programs. Technically, we are a state contracted agency, so we're not a state agency. We have a contract with the state to provide services. So we have a couple different funding sources.
Where's Cascade Park at?
Cascade Park Library, it's off of 136
Cause that's
in
where the free
Milton.
video music.
So, you know where the First Ever Community Center on 136, just north of Mill Plain, that's where it is.
Okay.
Mhm. The library is right next to there.
Is your transitional care coordinator, are they nurses?
No, but we are actually in the process of hiring a nurse. But our care coordinator, she is not a nurse, but she works very closely with, we have Medicaid nurses in our office that she works with, and she works very closely with the social workers and nurses at the hospital. So she's not, but we're in the process of hiring one for our department. If you know any nurses actually who are interested, please send them our way, because we're looking for a nurse to hire in community services.
And my last question is there a potential to have someone come up to North Country and train, let's say, some of our staff in, I know that we're the gatekeeper program, or that's kind of the general idea of where we're going. We're the gatekeepers as a general rule anyway. But is there a program that you can have come up to North Country to train some of the staff members here to be able to go out and do local stuff instead of calling directly for your services? We could be part of those services?
Yes and no. Some things, I mean, we can always come out and kind of work with people and do the presentations. A lot of the services are within our office, so they would still have to come through ours. Transitional care, I know there's like the community health workers there's community health worker training that is doing some of that. We don't currently have that through our office. So we can do trainings for the community to say who to contact, but really the best thing is to go through information and assistance, because services and resources change so regularly that we're gonna have the most updated information. So we do have resource lists. We're happy to come out to, do refreshers and do that, but we wouldn't really train you to be information and assistance specialists, because
Just what to look for.
we can definitely come out and do gatekeeper training. So we can train staff, we can train community members. We're happy to come out into the community and give presentations similar to this. We do have, this presentation actually kind of developed out of the gatekeeper presentation we started. And so we can kind of delve more specifically into certain programs, leave out some programs. This one, I went over everything to give a highlight of something random that you can refer people to, but we can probably do something in the middle of that to definitely come out and educate the community. We're happy to do that, whether it's myself or one of our information and assistance specialists. We're always happy to come out into the community and do presentations and share. Whether they're technically trainings or not, we have to kind of figure out the details a little bit more to know what we think would be the best option.
And what about Hipaa compliance? Have you found any barriers with us giving you information, or EMS in general giving information?
No, that's why we have the little consent saying, by signing this, I consent for them to talk to you and you to talk to them. We do have our HIPAA guidelines that we follow, and so you'd have to follow your own internal processes. We have to follow our own internal processes. We haven't found, we're new with this program of starting the referrals. We've only had a handful coming in. We have a lot of phone calls that come in, but we usually get the verbal consent. When we make the internal referrals, we have our own internal kind of confidential guidelines, so we haven't run into anything, but we are mindful of that, to be careful with that. That's why we have these forms, so that if you just call, we can't say, well, we went and saw John Smith, we did this, we can't tell you all of that. And if they don't sign it, you can still refer them, it's just we can't tell you what happened afterwards. And same with protective services. So I know, didn't talk about it, but adult protective services came up in some of the other trainings of how do we work with them, what do they do, where's the overlap, where's the conflict. We work with them, and so if you call us or you make a referral and it ends up being more appropriate for protective services, we're gonna tell you, because usually it's better for you to make that call so that there's not another middle person, but we're also happy to make those calls as well. You can do adult protective services and refer to us. We can work simultaneously of offering services, because there's a lot that protective services can't do. They can't go out and force somebody to take assistance. That's fine. They can't force somebody to take assistance, but they can offer. And so I know that was brought up, is how did they work and what's better, what's worse. One's not better than the other. But sometimes it is more appropriate to go straight to them. If it is one that you go into a house and, it's falling apart, someone doesn't have running water, there's animal feces all over the floor, that's more appropriate to call protective services, because that's an unsafe environment. we can still have somebody go out and offer them, you know, maybe other housing options, things like that. But protective services can also go in and it may be a case to maybe extend the property, things like that. We don't do that, we work with them to do that. So yeah, there is an overlap there when they're needed.